As families get together for Christmas, states across the U.S. continue to break daily records for new COVID infections. The fight is on to keep hospitals staffed and able to treat a surge in patients. The CDC now says healthcare workers who get sick can return to work after 7 days instead of 10, as long as they test negative and aren't showing symptoms. And the FDA has now approved 2 pills to treat COVID-19 after diagnosis. They're made by Pfizer and Merck. These reinforcements come at a time when hospitals are overwhelmed with sick patients. And if you're flying out today to see your family for Christmas, check with your airline one more time. The Omicron variant is leading to staffing shortages, and hundreds of flights have been canceled across the U.S. United Airlines has canceled more than 165 of their Christmas Eve flights. Delta Airlines has canceled at least 115. Both airlines say it's related to COVID staffing shortages. Courtney Kealy reports on how this new strain is spoiling Christmas for so many.
Americans are trying to avoid bringing COVID-19 home for the holidays, waiting in long lines for a test.
I'm sitting there at the dining table, we're opening gifts. The last thing I want to do is just be afraid that a hug will potentially put them in danger's way.
For some, COVID has already put a lump of coal in their stocking.
My brother just got diagnosed with COVID-19 like last week, so he's got to stay home until past Christmas.
Adding to the uncertainty, United canceled more than 100 flights today due to COVID-related staffing shortages. Delta, JetBlue, and others have also canceled flights.
I am aware of the risk that I'm taking by traveling during this time of year, especially with the variants going around.
Early studies suggest Omicron causes less severe illness than other variants, but experts say the unvaccinated are still at risk.
It's a little bit of a disaster mode.
In Southern California, St. Mary Medical Center put its triage tent back up after taking it down last winter.
We are worried that there'll be a peak after Christmas, mid-January, yes. So if we're busy now and we get even busier after Christmas, that's going to be really hard to manage.
New York City is scaling back its New Year's Eve celebration in Times Square.
We would normally have about 1,000 people in each viewing area. We're going to bring that down to about 250.
Revelers 5 years and older must be fully vaccinated and wear a mask to attend. Courtney Kealy, CBS News.
Let's turn to Dr. Bob Lahita now. He's a professor at the Hackensack Meridian School of Medicine and director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Lahita is also the author of the book Immunity Strong, which comes out next month. So, Doctor, you heard Courtney there reporting on how New York City is scaling back its New Year's Eve celebration. Broadway shows are closing because of this increase in cases from the Omicron variant. So how risky is it to be in a public place or a crowd right now? And what's your advice for families that are getting together for this Christmas?
Well, for everybody, Brad, it's important to be vaccinated and to have your booster shot. That's number one. The other thing that people must do is in public places wear a mask. If you're outdoors, it's okay. But if you're cheek to jowl with somebody at a ball game or at a concert, with this weather being so cold, it's probably not likely that you're going to do that, except in the West or Midwest. You should wear a mask. And remember to wash your hands as though they are contaminated every time you go into a closed space. That's really the most stable advice we can give. Remember, vaccination is number one.
So those protocols, we just have to repeat them. It's even more important right now. And as we mentioned off the top, concerns over staffing shortages at hospitals have led to some hospitals to change the way that they staff their when they bring people in. The CDC is shortening the isolation guidelines for healthcare workers now. Based on what you know about the virus and how it spreads, do you see that 7-day guideline extending to everyone else too?
I would think so. We're in a bind of sorts. And you've heard about, your previous reporter mentioned the airline cancellations on a day when people are flying to families, et cetera. With regard to healthcare workers, it's essential that they not be infected. We saw that with the Delta variant, where ICU staffs were low. People were not being cared for appropriately because there were not enough nurses or physicians, for that matter. You have to have a negative test and you have to have negative symptoms to go back to work. But 7 days, we're saying, is enough for you to stay at home while you're presumptively infected.
You know, Doctor, the FDA has now approved Merck's antiviral pill to treat COVID-19. It happened yesterday, just a day after it approved Pfizer's pill. But the agency is only recommending it for people who are high risk and who don't have other treatment options available. Why is that?
Well, because first of all, the pill is rather difficult to manufacture. It's a big chemical process that's going to take many, many weeks. And second of all, the monoclonal antibodies right now, which are useless for the Omicron variant, apparently, these antibodies are not readily available. There's a shortage of that treatment, which, as you know, is only in the emergency room when you're feeling very, very sick. So this pill or these pills are for those for those therapies like monoclonals are not appropriate or they are inaccessible, such as the immunosuppressed people who have very, very lagging and weak immune systems. A pill like this would be extremely useful. And also the Pfizer pill Paxlovid.
Of course, Dr. COVID isn't the only virus that's going around. Let's look at the latest flu numbers from the CDC. The agency reports that there were about 2,500 flu cases the week ending December 11th. That is about average for this time of year. But last year, we saw fewer cases of the flu because people weren't getting together. Are you concerned about the flu coming back while we're dealing with this COVID spike around the country?
It makes it confusing, Brad. If I'm in the emergency room as a doctor and I see a patient who comes in with difficulty breathing, aches and pains all over, a fever, I have to differentiate the flu from COVID. And that can be a problem because the flu, while not as severe as COVID and probably not a major cause of death, although people do die from the flu, it is a difficulty that we don't need at this particular time, particularly in the season when people are gathering together, and these numbers are going to rise in January, and that's going to make what's already bad a lot worse.
Dr. Bob Lahita with some good COVID advice for us this Christmas. Dr. Lahita, thank you.
Thank you, Brad.